Various topical preparations are offered to help reduce the appearance of skin aging. Skin aging is, well, it's almost an inevitable consequence of aging. Everybody gets a little old. The extent of facial aging depends on several factors, including genetics. A lot of people, because of certain genetic factors, they show less facial aging. Another factor is sun exposure. Being involved in bodybuilding, I know that when I competed years ago, many years ago, we used to lie in the sun. I don't know if the bodybuilders today do or whether they rely on makeup to give them a tan, but back then, Arnold, all those guys in that era, we all laid in the sun. A lot of us weren't really aware of the effects of the sun in inducing skin damage by breaking down the major structural proteins in the skin, which is collagen and elastin. Collagen is the main structural protein that basically lifts the skin up, and the elastin is the thing that provides elasticity to the skin. When these two proteins break down, you have fine lines and wrinkles. They all start to appear. Now, so in other words, what happens though is, oftentimes when you're young and you lie in the sun and you get a great looking tan and your skin is still fairly flexible, your skin is still renewing itself. A process called skin cell senescence hasn't yet occurred. Senescence involves a aging effect of cells where the cells stop replicating and they kind of just sit there. And unfortunately, they release inflammatory factors which cause all kinds of problems. Cellular senescence is a major cause of aging, but in the skin, the senescence of skin cells is also a major cause of facial aging and skin aging. So all these factors combine so that, if you lie in the sun a lot when you're in your, let's say, 20s, suddenly you'll, when you hit about 40, 50 years old, you're going to get a lot of wrinkles on your face. It's suddenly going to start showing up. But this is damage that was there, induced many years earlier, but was hidden because of the extent where your skin cells were still replicating. Senescence hadn't set in. You had a good amount of collagen elastin was still being produced. So it kind of kept the wrinkles and lines at bay. But as you get older, your body becomes less efficient at these processes. Another reason for skin aging is bad health habits such as smoking and drinking. You might have heard of smokers' lines. These are these lines that smokers get around here, around the lips and stuff, these fine lines, going like this with the cigarette, That also, smoking, also because of the chemicals and the oxidation effects induced by smoking, and that includes cigars and pipes, that also helps to break down the structural proteins in the skin and contributes to facial aging. Another reason, or a very common reason, why people start to show facial aging as they get older is because of the loss of fat in the face, believe it or not. In fact, this has become an issue with a lot of those popular drugs, what they call the glucagon-like peptide 1 or GLP-1 agonists, such as Ozempic, Wegovy, and Mounjaro. These work by mimicking the effects of GLP-1. They do promote significant fat loss. More importantly, for people who have diabetes, they make the control of insulin much, much more effective. But they are so effective at causing fat loss. Some people have lost as much as 80 pounds in a couple of months using these drugs, and you get this effect called Ozempic face. See, when your body loses fat, it doesn't lose fat in just one area. This is the reason why doing thousands of reps of abdominal work is not going to really give you great abs or reduce your waist, because when your body loses fat, it loses it everywhere, systemically. There's no such thing as spot reducing. These people that are doing thousands of reps a day are just basically hitting their heads against the wall, but You'll never convince them of that. And, that's forget it. But anyway, the point being that when they lose a lot of fat using these drugs, a lot of the fat comes out of the face. So the fat that was formerly disguising their fine lines and wrinkles now come to the fore, where some of these people who go on these drugs, these GLP-1 agonists like Ozempic, and they lose, let's say, 60 to 80 pounds, something like that, or even 40 pounds, because they've lost so much fat in their face, the lines and wrinkles that were hidden by the fat now come out in bold relief. So they look like they've aged as much as 10 or 15 years in a matter of months. It's a kind of a scary effect, but some people think it's worth it. They'd rather have the weight loss. They don't care about looking older. Other people try and combat it. They can try and combat facial aging with techniques such as plastic surgery, of course. Plastic surgery, facelifts. A lot of your Hollywood stars are very heavily into plastic surgery because they think that staying young, the younger you look, the more parts you get. Especially with women in Hollywood, there's an old saying: once a woman hits 40 in Hollywood as an actress, she's done. Men could work a little bit longer before they get kicked to the side. And of course, if you're a major star, or what they call a superstar, you can continue to work even in your 60s and 70s, as a certain form of bodybuilder still does. But to people who don't want to go the plastic surgery route, they often look to what they call cosmeceuticals, which are topical preparations that are said to help reduce the look of facial aging, such as fine lines and wrinkles. And you have a lot of them to choose from. From a medical point of view, probably the most effective single topical preparation to reduce the look of aging in the face is called Retin-A. It's a form of vitamin A. Retin-A, if you put it on, what it does, it stimulates, it's absorbed through the skin, and it stimulates the production of collagen and elastin. And it's not going to make a 70-year-old look like a 19-year-old, but it is pretty effective for reducing fine lines and wrinkles to a certain extent. In fact, Retin-A is probably one of the only topical preparations that's accepted as a treatment for facial aging by most dermatologists. But there's another possible solution or partial solution to facial aging that most dermatologists believe is useful, and that, believe it or not, is the B-complex vitamin niacinamide. When applied in a topical form at a strength of about 5%, they've shown that niacinamide penetrates the skin surface readily, and it's bioavailable from a topical application. And clinical evaluations of topical formulations containing niacinamide have identified a wide range of skincare benefits. These include reductions in the appearance of hyperpigmented spots. Hyperpigmented spots are these like little dark spots you get. Older people, they get these dark spots on their face. That's from excessive pigmentation. That's excessive deposition of melanin, which is the main skin pigment. That's the stuff that gives you a tan when you're exposed to ultraviolet light. Your skin secretes melanin as a form of protection, and that's what causes a tan. A tan is, in fact, can be considered a silent scream from your skin. It means that the skin is being damaged. A tan, by the way, is anything but healthy, but that's another story. So using the topical niacinamide, it helps reduce the appearance of hyperpigmented spots, redness, yellowing, or sallowness. It reduces surface sebum. Sebum is this oil that's secreted from the pores in the skin. Sometimes it gets blocked, and bacteria go to work on it. They like it. It's like a food for bacteria, one called P. acnes on the skin, and it causes conditions such as acne. Now, when you get older, a lot of times your skin pore size increases, and also this contributes to the look of facial aging. Niacinamide in topical form has been shown to reduce the size of pores on the skin. Niacinamide improves the surface texture of the skin and, of course, fine lines and wrinkles. There's also niacin also improves skin moisture by promoting a certain a certain substance, ceramide, in the skin. Ceramide is a substance that holds water in the skin, as does another substance called hyaluronic acid. A lot of people take hyaluronic acid supplements to help, make the skin a little bit puffier, which makes you look, it tends to, again, disguise fine lines and wrinkles. Now, also the niacinamide improves the stratum corneum barrier integrity. The stratum corneum is the upper layer of the skin. You have the deeper layer is called the dermis. Then you have the epidermis, and then on top of that is the stratum corneum, which is dead cells lining the skin. But it also, the stratum corneum acts as a barrier on the skin. It also improves skin elasticity. The stratum corneum prevents, let's say, pathological organisms from penetrating deeper into the skin. So now, as I said, some studies show that niacinamide can help with prevent acne. Of course, niacinamide is also called vitamin B3, and it's present in many food sources: meat, nuts, whole grains, legumes, yeast. And there, of course, you can get supplemental forms. And there's three primary forms of niacinamide that have been used. I'm sorry, three forms of B3 that have been used in topical skincare: niacinamide, nicotinic acid, nicotinate esters, such as benzyl nicotinate and myristinol nicotinate. But most of the studies that have shown skin improvement have involved topical niacinamide. Now, the mechanism of actions is that niacinamide is a precursor to these cofactors called NAD and NADP, which are involved in many biochemical reactions of the skin, also involved in energy production. You might have heard of NAD boosters such as NMN and NR. These are popular supplements that are supposed to increase NAD. A lot of the commercial hype says that NAD levels decrease with age, and it's a major cause of aging. However, that isn't necessarily true. That's over-exaggeration of what happens to NAD, and I discussed that in my Applied Metabolics publication. I'm not going to get into it. NADH has been observed to inhibit some of the enzymes involved in the synthesis of something called glycosaminoglycans, or GAGs. Now, GAGs are too many GAGs that accumulate in the skin are also involved with skin aging. So the mechanisms of niacinamide in helping to improve skin appearance, they could be summed up as follows. It inhibits sebum production, specifically the content of diglycerides, triglycerides, and fatty acids. And this leads to reduced acne, reduced pore size, and improved skin texture. Niacinamide in topical form stimulates the epidermal skin barrier, lipids, ceramides, and also it stimulates skin proteins such as keratin, involusin, I can't even pronounce these, and filigrin. I've never heard of them. Don't ask me about them. The net effect is it improves skin barrier and moisturization. It reduces the skin redness, and it improves an appearance of a skin condition called rosacea, which involves a rash-like appearance of redness on the skin. Niacinamide in topical form also has an anti-inflammatory activity by inhibiting the release of inflammatory cytokines. Cytokines are proteins released by the immune system that are involved in the immune response, but in excess they cause systemic inflammation, including inflammation in the skin. And this has the net effect of anti-aging effect. It reduces skin redness, and it also improves the appearance of rosacea. Now, the topical niacin 5% increases the production of collagen, which of course is the main structural protein in the skin. It also inhibits the production of excess dermal GAGs, glycosaminoglycans, which has an anti-wrinkle effect. It also inhibits a melanosome transfer from melanocytes to keratinites, which reduces hyperpigmentation in the skin. It also inhibits protein glycation by antioxidant effects, which inhibits skin yellowing and helps skin protection. There's some research showing that topical niacinamide at 5% and niacinamide orally can blunt the inhibition of the immune response in the skin that's caused by exposure to ultraviolet light, which is the cause of skin cancer. So, as I said, by stimulating the keratocyte proliferation, the topical niacinamide also aids in wound healing. And like I say, it stimulates the production of collagen and messenger RNA, which also has anti-wrinkle effects. It stimulates two different types of collagen. It stimulates various substances, proteins in the skin that maintain skin barrier integrity, and also reduces the appearance of fine lines. So, as I said, let me see, what else can I say here? There's a study. This was a study published in 2006, and the purpose of the study was to clinically determine the effect of topical niacinamide on additional skin appearance and points, including wrinkles, yellowing, and elasticity. The study involved 50 white female subjects with clinical signs of facial photoaging, fine lines and wrinkles, poor texture, and hyperpigmented spots. They applied 5% niacinamide to half of their face and a vehicle control to the other half twice daily for 12 weeks. Facial images and instrumental measures were obtained at baseline and at 4-week intervals. Analysis of the data revealed a variety of significant skin appearance improvement for topical niacinamide, including reductions in fine lines and wrinkles, hyperpigmented spots, red blotchiness, and skin sallowness or yellowing. In addition, elasticity was improved. That was a study that was published in 2006, basically showing that niacinamide was actually effective at reducing some of the uses of aging. What about side effects? Niacinamide at 5% topical solution is generally well tolerated. In some rare cases, a mild skin irritation has been observed. Now, the nicotinic form of B3 can be problematic for topical use due to a skin because it has causes skin reddening due to vasodilation that occur at doses less than 1%. That's rare. So I think that about covers it for niacinamide, topical niacinamide. So you could sum all this up by saying that topical niacinamide in a 5% solution, which I don't think you need a prescription for that. I think I've seen it in drugstores. I've never used it myself, but I've seen it available, and I know it's available. I know for a fact that it's available over the internet at varied cost. I've seen it for as much as $100 for a little bottle of it, to as low as something like $20. So look around and find the best price. As long as it's genuine 5% niacinamide, use it twice a day. And as with Retin-A, which is the other effective topical skin, let's say anti-aging solution, it takes time. Don't expect results overnight. Even Retin-A, which is a pretty powerful form of topical therapy, it takes a while. It takes weeks to months before it shows any changes in the skin, because what this stuff does is it increases the production of the skin proteins, collagen, elastin, and that doesn't happen. It takes a while for that to happen. And the same with topical niacinamide. It will reduce fine lines and wrinkles. It'll make the skin look healthier. It takes some time. You got to give it a couple of months. Give it at least 4, 5, 6 months before you see results. So from my research, in my opinion, these two are probably the only really useful topical substances that can actually help reduce some of the lines of facial aging, some of the look of facial aging. So that's about it for this topic. If you want more information on nutrition, exercise science, anti-aging research like I just talked about, ergogenic aids, hormone therapy, supplement science, effective fat loss techniques. All of this, women's health and fitness, all this is covered in my Applied Metabolics publication, the only publication on the internet that comes with over 60 years of constant study and knowledge. There's no other publication that has that level of experience. And it's anywhere from 25 to 40 pages every month, no ads. It's written in plain English. I've been a writer for over half a century. I know how to write for the public. You don't need a medical dictionary, unlike a lot of other digital publications, which read like PhD dissertations. I mean, they're not really written for the public. They're but I guess they're not supposed to be. But anyway, that's another story. But the point is, subscribe today. It's not expensive. It costs like the price of a cup of latte at Starbucks, and you'll get a lot more benefit from Applied Metabolics. It could actually save your life. I cover a lot of off-the-road topics that are not covered in your typical blogs and YouTube videos. I guarantee you'll learn something from every issue. So subscribe today. It's www.appliedmetabolics.com. If you think my videos here on this channel are of any use, please subscribe. It is free. I post a new video every Tuesday. And please tell others about this channel. Like I say, this is one of the only honest channels left on the entire internet. From what I could see, I don't look at most YouTube videos anymore because I'm just, quite frankly, tired of the BS they spout. I mean, they're always trying to push products on me, on you, or anyone who watches it. And a lot of the information is just wrong, dead wrong, including the exercise and nutrition information being offered. It's garbage. Not all of them. There's a lot of good information in some of the videos, but I would say about 90% of it is garbage. And that's based on my experience in viewing a lot of these. And unfortunately, a lot of this misinformation is being spouted by people with professional degrees, including MDs and PhDs, who are, they're pushing products. They make a lot of money on these products. They're pushing useless products. They have no integrity whatsoever. And in my opinion, that they should not be. They shouldn't be. You should not support these people, because they're charlatans. They're crooks. They have a huge following, much greater following than I'll probably ever have. But the difference between me and them is I tell you the honest truth. They give you bullshit, to put it bluntly. So subscribe to my channel. Subscribe to Applied Metabolics. Again, www.appliedmetabolics.com. When you subscribe, send me an email, and I'll send you an invitation to join my private Applied Metabolic Facebook page, where each day I post new information on exercise, nutrition, and general health and medicine. I have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they read in Applied Metabolics or anything that comes to mind pertaining to nutrition and exercise, and I will answer the question as a sort of bonus or appreciation for their subscription to Applied Metabolics. This only applies to current subscribers. So if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. I'm on my way. I was supposed to get some dogs about 2-3 weeks ago. It fell through. 2 other chances to get dogs also fell through. So I'm going to just go to a shelter, pick up a dog, and take them. Actually, my preference is to foster an older dog, because older dogs I've had several dogs. I had them all the way to the end. Older dogs are very sweet. They're very loving. They're very gentle. They're great to be around. They cheer you up. And the truth is, a lot of people don't want to take older dogs. They go for the puppies. But I want to help an older dog, so my preference is to foster an older dog. So anyway, that's about it. Take care. Thank you for listening. And Happy New Year, by the way. This is being recorded right after New Year. So Happy New Year. I hope you all have a great New Year.